Hi, Dr. Nashat. Welcome to Royale Hayat Hospital for the first time patient experience conference in Kuwait.
Thank you very much. Most welcome. And I'm delighted to be with you here at the Royale Hayat Hospital.
Thank you. Thank you so much. What type of culture, doctor, do you think the organization need to enhance the patient experience?
Okay, good question actually. And the culture we're speaking about today, and it will be for the next hours, is the excellence culture. Excellence culture, it's like how to put and seed this culture in the organization so the organization could benefit from these seeds on the long run, and when it is a flourish, that the benefit will come to the workers because they are the people who provide the service and benefit the patient who is the center of the service. So excellence culture, it is the right culture which will in the future will make it as a just culture for everybody.
How are you, Dr. Abu Bakr?
Alhamdulillah, how are you?
And you are pleased that you are our chairman and our doctor.
It's a pleasure to be in this organization, and I'm really pleased that our meeting so far is going very well.
That's right. Thank you. Why did you do this experience, this conference?
I think, as I said, that healthcare is moving fast. And we know that our job is to make sure that our patients are having a good care. So now the healthcare have to look well to the experience of this patient. Patients want to be safe, patients want to be asked, patients to be convinced that what we do is the right thing. And that's why in Royale Hayat we decided that we are going to this journey. 2017, we had a small team. We went to Abu Dhabi to learn about what is patient experience. And I'm very glad that our team have developed and has grown up. And then it's the time where to empower this team. As you see that in this meeting today, we have one of our patients who gave us a clue about what she expected from us. And I think the way ahead is patient experience became very important for any organization in healthcare to move on. If you don't have the link between your patient, you didn't ask the loyalty, you involve them. If you go to Europe, a lot of patients, there is a patient committee who are helping the hospital, giving them a clue about that. And that's why we did this conference. I'm glad that we are the first hospital in Kuwait to run this conference, and we are the first time. So it's the first time in the MOH and governmental hospital and the private sector. And I'm pleased. I think we have a wonderful speakers, and I'm very glad to the Saudi Health Board for Quality. All the team, they came and they have given us, and they're still giving us more talk.
That's right. Thank you so much, Dr. Abu Bakr.
It's a pleasure.
Thank you. Welcome to Royale Hayat for the first patient experience in Kuwait. First of all, I would like to tell you how amazing your presentation was and how beautiful smile you have. You really encouraged me for myself, really.
Habibti, it means a lot, wallahi, to me, to be here in Kuwait for the first time and to be in Royale Hayat, even a great hospital. I heard about it for a long time. And I'm here finally just to see how this hospital is doing good in starting the patient experience.
How do you measure the success of patient experience?
Well, first you need to define the patient experience, that you have a lot of touch points in the journey for the patients. So it's not only measuring the physician, and it's not only measuring the nurses or the pharmacy or the parking. Even when we ask where does the patient experience start, no one knows. However, why I always say that patient experience starts once I think that I have a pain and I need to go to a physician. So I will Google the hospital name, and I will see in Google what it takes for this hospital to treat me. So back to your question, how we can measure, we need to measure each touch points and have specific KPIs for this. So if you are in the pharmacy, you need to see how the pharmacist was there, if they explained the medication properly for you, and if they dispense the medication in a timely manner. So you need to have KPIs for each touch points. And in Saudi Arabia, mostly, and in our hospital, we use Press-Ghani, which is a third-party companies. They measure the patient experience for us. So we are just receiving what the patient is saying, yes, about us. So yeah, this is the answer.